Hello, this is Dr. David Green, CEO of the TEX-PAIN Network. Today's topic is what you need to know about spinal cord stimulator implants. A spinal cord stim is a revolutionary device that is permanently implanted around the spinal cord in an effort to provide pain relief to those with chronic pain. It can work well for either chronic back or leg pain, and if you do it in the neck, it can work well for chronic neck or shoulder and arm pain. A spinal cord stimulator is considered a last resort treatment. It does involve a surgical procedure. It's very expensive for insurance companies. It doesn't fix the problem, but it masks pain. So if you don't have a surgical solution to the problem, it can work really, really well. It's not a first-line treatment. As mentioned, it doesn't fix the chronic pain problem. It's an excellent last resort option for those who have failed back or neck surgery syndrome, post-laminectomy syndrome, RSD or CRPS, diabetic or peripheral neuropathy, and those with testicular, pelvic, or abdominal pain. Spinal cord stimulator can take a person with chronic pain, depression, and inability to work and completely turn one's life around. It's been shown to work well for back, neck, arm, and/or leg pain. The person will need to have a trial placed first, which is a low-risk procedure, and it's an excellent last resort option when surgery is no longer indicated. It can decrease the need for narcotics substantially. The first step is a trial implant. This is percutaneously placed. The person is sedated but awake while it's being implanted so that the pain doctor can ask if where the placement is helping with pain relief, say the right leg, for instance. It's attached outside the skin to a programming device. It's placed under sedation, as mentioned. It's worn 5 to 7 days. If over 50% pain relief is achieved, the second step is a psychological evaluation, which is what insurance companies require to get approval for the final implant. The final implant is completely planted under the skin. It takes about an hour. It consists of a large paddle lead, which I'll show you in a moment, for better coverage. A pain doctor will remove a little bit of bone around the spinal cord area so that they have room to put it properly. And then the wires go underneath the skin to the battery pack and programming device, usually above the buttock area, subcutaneous. There's over 200 programming options available with the newest ones, and they're also rechargeable through the skin. How well do they work? There's been quite a few studies done on their effectiveness. 84% have had life greatly improved in one study, 77% good to excellent pain relief for multiple indications in another. For diabetic neuropathy, a recent study showed 85% substantial sensation recovery, and over 3/4 had significant pain relief. Okay. For RSD, spinal cord stimulation works extremely well for pain relief. Here you can see the size of these batteries now and the programming devices. Look, they're like not that much bigger than a quarter. It's crazy how small they've gotten over the years. Okay. Now, if you look at this one, you can see the paddle lead, and this has a ton of silicone diodes, and those help with all the programming devices. What are the risks? There's a risk that the device will stop working after a period of time. With 200 programming options, usually there's something to turn to get it to work again. Potential for migration of the leads, infection, bleeding, wound breakdown. The top non-operative pain management in the Dallas-Fort Worth Metroplex is through the TEX-PAIN Network. There are several clinics throughout the region accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com, and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Green with the TEX-PAIN Network. Your pain stops here.